So I think in some senses my clinical knowledge was very helpful, and probably in other ways it was actually harmful for me especially. One of the big advantages I had is I spoke oncology. And so I knew all the terms, I knew what everybody was talking about. I think that was actually sometimes detrimental for my husband because, again, conversations were more easily directed at me. And so terms that usually would be explained, again, people just kind of assumed that we understood. But I think that in that kind of initial shock, I didn't have to learn a new language. I think also, I had access to a network that almost no other parent has. So I was speaking with people at Dana-Farber. We got a second, they joined together to give us a second opinion and worked, again, the oncology community across the country worked together to devise this treatment plan. Not, I think, because he knew it was me, but I knew very quickly what to ask for. And at that point, actually, we had looked to go somewhere else, like Dana-Farber, and couldn't because of COVID. But I had those type of supports. I think that other people don't have. I also, as soon as they found that second cancer, I requested a formal palliative care consult, and I knew that I could do that, and I knew in my mind this was absolutely the best thing to do for my child, and some of it was at that point nobody had any idea what her prognosis was. I was told, well, it's between 0 and 100. Okay. But more importantly, I think that all of the drugs that she was given are cancer drugs used in pediatric cancer, but they aren't given in that combination. And so no one knew what this was going to look like from a side effect standpoint. And because these were my palliative care colleagues and also my friends, I knew there was no one kind of better at managing symptoms than them. And so I really, from the get-go, had that knowledge to pull that team in right at the beginning. And that remains one of the best decisions I made. So I think the hard thing is that for every side effect they discussed as they go through these drug sheets, and we usually, when I'm sitting with families and they're being discussed about their child, they say, like, everybody gets some side effects, nobody gets all of them, especially these really rare ones. Well, I had been a part of, probably over 200 kids' treatment plans. And so for those very rare ones, I could picture a child and knew what that could look like. And so in that sense, I wish I'd been a little bit more naive because I knew exactly what could happen. And I remember all of those kids. And so I think that was actually really hard for me, that it was very, very easy for me to quote a kind of worst case because I had the representation of what that looked like. So I think that was probably the hardest thing for me.